Hi everyone, we're excited to give you a demo on how Tupaia can support your project or country with collecting data in health facilities on a national level. Now, first and foremost, to achieve a national facility survey, it takes a considerable amount of planning with relevant countries, ministries and local teams to ensure you capture 1. Minimum standard questions on health facility types, 2. Making questions actionable, 3. Requiring significant logistical planning to reach and survey the country's most remote facilities, and more. But what we'll do is we'll talk about what is Tupaia and how Tupaia can support your national facility surveys. Now, Tupaia has 3 main features when it comes to the national facility surveys. Number 1 is that Tupaia has the ability to capture data both online and offline, allowing surveys to visit the most remote facilities and capture insights without requiring an internet connection, while still having the ability to sync the data collected at a later stage once internet is available. 2, we can map the location of health facilities with our inbuilt geographical information system. And 3, we can visualize all that collected data through map overlays and dashboard, allowing a project and country to make data-driven decisions, and we'll talk more about this later. So let's talk about facility interviews or assessments. Now, surveys will follow a planned itinerary to interview and assess all health facilities within that area. And to ensure our data is accurate when interviewing our facility, we have inbuilt conditional formatting or smart formatting to ask the right questions to the right facility types. And this involves spending from 45 minutes to up to 2 hours collecting data on all aspects of our health facility operations, from item availability to services being available, infrastructure repairs, and more. We collect over 750 data points for health facilities, which means we need to ensure that we can present this data in an easy and digestible way. And some ways we do this is through map overlays, dashboards, photo galleries, and even our facility action plan, which we'll go through all of those in just a moment. Map overlays provide you with a high-level glance on a specific topic, allowing you to filter based on answers. Now, in this example, I'm filtering through 3 demo facilities I created within the state of Victoria, Australia, by selecting different facility types. And a great example where map overlays are helpful is identifying if a specific medicine is available or not, with green showing as it is available and red showing that it's not available. And you even have the ability to select each answer to identify the facility that this is applicable to. Dashboards are a great way on viewing categories of data on a hierarchy level. Now, on the right of screen, we can see that we've built various categories of dashboards, from health services provided, equipment availability, and more. And within each dashboard, we have various dashboard items to provide you with breakdowns on answers from availability, or in this example, a country's lowest 20 performers, allowing ministries and countries to support and improve the health services being provided in an area. Something we're super proud of is our facility action plans. Once data has been collected for a facility, we have the ability to generate a report that shows what medicines, equipment, and health services are not available, as well as infrastructure damages and repairs required. And this will be generated on an official letterhead, which you can send to relevant parties who are wanting to address quick wins within a facility or identify key structural issues that require repairs. Last but not least, our photo galleries. Now, Tupaia has the ability for surveys to take pictures of key infrastructure damages, which we can present within a dashboard to show the issues a facility are facing. And these photos can also be included and generated with our facility action plans. And to support your facility assessments, we have a feature in Tupaia called tasking. Now, tasking gives you the ability to create once-off or recurring surveys for an entity or facility to help you track changes over time. And this can be done one of 2 ways. Way number 1 is through our data track dashboard through the My Tasks feature. And the second way is creating a tasking question in an actual survey. Now, once a task has been created, you can actually see in your dashboard who it's assigned to, if it's overdue, or if there's anyone unassigned, and it gives you more information around the surveys, the entities, the owners, if it's repeatable or not repeatable on all outstanding tasks, giving you that ability to make sure you can track your facility assessments and resurvey certain facilities that may need additional surveys to see if the changes have been done over the course of a year or two. You even have the ability to leave notes in a task that gives instructions as to why we're conducting that survey. And once that's been done, you have the ability to click action, and then you can actually go into that task and start surveying that facility. And most importantly, why should you conduct a national Tupaia health facility assessment? Well, the data collected will provide you with various overlays and dashboards across your country's hierarchy, identify your lowest 20 performing facilities across all categories of questions, and have comprehensive facility action plans, allowing you to use this data and make better informed decisions to improve the health services and needs to your communities throughout your country.